What is sciatica? My name is Bilal Kassem. I'm the managing partner at Pacific Workers, and today I'm going to explain what is sciatica, how they come up in workers' comp cases, and how the claims are typically resolved. First, sciatica refers to nerve pain in the back, traveling down the sciatic nerve. And oftentimes this can be represented by a certain set number of symptoms, things like numbness, tingling, or burning pain that runs down one leg or the other. The most common way that people have a sciatic nerve injury is due to an acute back injury. For example, they fall or they herniate a disc from lifting too heavy. However, sciatic claims can also come up from what's called cumulative trauma, which is repetitive wear and tear, meaning heavy-duty construction work or labor over the years can ultimately impact the disc in your lumbar spine, causing a sciatic nerve injury. These cases come up more frequently, I would say, in the context of an acute injury. However, like I said, they can happen in cumulative trauma. Both of these are types of injuries that are covered by California workers' compensation. So if you either hurt yourself and it's something that was tangible, you fell off a ladder, or you've just been on the job for a long time and started noticing this type of back pain, you can file a workers' comp case. The cumulative trauma case is pled as an injury that happens over time, whereas the specific injury is pled on a specific date. When you get hurt on the job and you've alleged a back injury, typically you'll go to an occupational clinic. They'll do things like physical therapy, they'll give you medication, they'll put you on work restrictions or take you off of work, and should the pain or symptoms not resolve, they'll do things to confirm a nerve injury like MRIs and what they call EMG or nerve conduction studies, which test whether or not there's nerve impingement. And so ultimately, depending on how significant your injury is, you'll ramp up through medical treatment and you will get things like MRIs or diagnostics to confirm whether or not you have a disc injury that's impacting your nerves. Treatment can vary depending on the type of injury you have. You can have things like epidurals, you can have things like pain medications, physical therapy, functional restoration, and potentially even surgery. However, doctors don't typically like to rush to surgery, and you are in no way obligated to actually get surgery. Once your condition's medically plateaued and your nerve pain has either been resolved or not, and you still have it, you ultimately will likely have options to settle your case, either by what's called a stipulated award or compromise and release. Typically, a compromise and release means that they buy out your future medical care, which then means it's your responsibility to take care of your disc issue in your back, either through private insurance or out of your own pocket. A stipulated award means that the insurance company will continue to cover your back pain for the rest of your life as long as there's doctors that feel as though your injury still needs treatment, and that treatment is due to the work injury itself and not some other intervening source. So again, sciatica injuries are very, very, very common in workers' comp. We see them in the context of cumulative trauma or a specific injury, and ultimately they can be very serious life-changing injuries which require significant medical treatment. So if you're going through an injury like this, or you're not sure whether or not you've been injured due to cumulative trauma, I highly recommend you contact a lawyer right away and at least get a consultation. They can point you in the right direction so that you get on it, you can get your treatment, you can get better as soon as possible.